Awesome. Well, I know some other folks will hopping on, but we'll go ahead and get started. Thank you, everyone that's hopped on. Thank you for joining. We're really excited to get into some more on federal grant budgeting today. And we hope that we can share some information that's helpful to you as you're working on building out your own projects. Many of you know Elizabeth. Elizabeth is the owner and principal of Burrows Consulting. She's passionate about empowering health centers and hospitals across the US with resources they need to serve communities well. Elizabeth has been writing and managing grants for over 25 years and has significant experience in both budgeting and project management. And she served as CEO and executive director of FQHCs and the FQHC lookalikes. Elizabeth is also joined by Suzan Overholser. Susan is a senior financial consultant with Burrows. She has also extensive experience in strategic financial planning, as well as in operationalizing organizational budgets in a health center setting. So she's worked with both for-profit and nonprofit organizations, as well as in small business ownership. And with Burrows, Susan has experience overseeing financial strategies that support sustainability and the growth of community health centers. So we are excited to get into this, and I will turn it over to both of you.
Thank you. Again, we're excited to be working with you today to show you the similarities and differences in your budget for both organizational and project-driven budgets. As part of our agenda, Kate, we'll be talking about our rules for federal budgeting, common mistakes to avoid, how to show sustainability, what's allowable, and then the role of the budget narrative. But to kick us off, Elizabeth gets to cover the rules.
Yes, and keep in mind, these are ever changing. And one of my mentors, Mark Lynn, always said, this is the facts as of today, Earth Day 2025. So everything is always changing. So he always said, put a disclaimer on. I don't put those in my presentation, but I am channeling Mark when I say that. And some of you may know him. He might have helped start your rural health clinic. But we do follow 45 CFR Part 75. And if you want to look that up. CFR stands for Code of Federal Regulations. This is public information. You can pull that law yourself. If you're a CFO, and I think I see one or two of you on as well, you probably know this. We're following cost principles, documentation requirements. Those are changing, especially as we're moving into everything being electronic. So make sure to check those. In fact, I was in a health center last week where I still saw a room of documents that they haven't destroyed yet because they're still holding things. So again, check that. Your uniform administrative requirements, audit requirements. If you get over $750,000 per year through any sort of grant, you have to go through an A133 audit, and that needs to be done by a CPA firm. If you have questions about that, you can reach out to us, but we don't offer any of those services, but you do need to make sure you go through that, and you need to do some sort of performance measurement. Also, read the rules of your grant and your notice of award. I still say NGA, notice of grant award. It's now NOA with the federal programs, and you should get one of those with every single foundation grant or state grant. Actually read those contracts, read those letters, because there may be additional reporting requirements for certain grants. And they do change them. So again, read the fine print and also read the footnotes, because there are certain requirements on those items. So again, keep in mind too, the short version of like what I like to tell everyone, if it's within the same budget category, you can move it around. Hypothetically, if I hire Susan as a nurse practitioner and Susan decides she doesn't want to be a nurse practitioner, and instead Kate is a physician assistant, and I'm able to attract Kate because she just moved to the area to fill that position, nobody cares. Okay. They don't care that I hired Susan instead of Kate. Okay. Really, they don't care. It's the same position. It's within the same personnel category. Okay. Now, if I'm moving from one category to another more than 25%, I need to get permission. If I decide I'm not hiring anybody and instead I'm going to contract with some other group to do telehealth, then, and it's going to be all contractual, I would need to get permission. But again, just know within a category, it's all good. And you can switch up to 25% from one category to another. That is a short version of the federal rules of what we all really care about. Thank you.
Thank you. As we get further into the subject, we're going to give you our successful approaches for budgeting. And many of these are just recommendations versus hard rules like your 45 CFR. Even Elizabeth and I often approach a budget differently. She approaches a budget from the perspective of CEO. I approach a budget from the perspective of a CFO. Having both lenses actually produces a better budget, which leads us to the next point. Do not create your budget in a silo. The budget and the written narrative must tell the same story. So they work. So you're going to be working as a team so that you have a consistent funding request. As part of that effort, prior to even applying for a grant, you need to make sure your organization has the reporting capacities to fulfill those grant requirements, as Elizabeth alluded to. And this is a big one, you already have identified who's going to be responsible for that. And if we're working in silos, your quality person may not be aware that they're going to have to be reporting on all this data that you're writing this awesome grant for. Okay, on the NOFO, again, excuse me. Elizabeth also referred to that. You must read the NOFO. I will share with you that one of the, I will say fallacies of a CFO, I'll talk about myself, is when it came to doing, they'd come to me as going after a grant. I'd read the NOFO, only the budget section. That is not a best practice because it does not give you the total perspective of the grant. You don't have to consume those 80 pages, but if you read that NOFO, you have a really good understanding of what the funder expects out of this grant so that you know where to allocate those funding dollars. It's very important. You also, I will share with you that there have been times frequently when in the NOFO, not the budget section, we'll find unallowable expenses. And you want to make sure that you've caught that. And if you're just reading the budget section, you may miss that. Okay. On to the next slide. One key principle that I always try to keep in mind, and this is Elizabeth says this to the whole team on our approach to a grant. Make that budget easy to understand for your reviewer. Keep things simple. Your goal as a person that's creating this budget is to make it easy for your reviewer to understand. If a template is provided, use it. This can actually expedite the review process because your reviewer is used to seeing that template. If it's okay to use a worksheet, say you've got a worksheet that has worked well for you for years and you're familiar with it, it's okay to use that worksheet to create it. But once you've created your budget, it should go into the template that is provided. I will note that a lot of federal grants have now moved to portals instead of allowing for that upload of your budget. It's being put into a portal. These go to the cent many times, and it can throw our budgets off. And you have to be, aware that if it's a $200,000 limit for a grant, if yours is 200,004 cents, you're going to be kicked out. So it's very important that you adjust to those portals. The other thing that I would recommend always is to adjust your worksheet or your Excel document to what actually went into the portal, because we know that technology is not always perfect. And even though you're supposed to be able to upload a copy of that portal, there have been times when that doesn't happen. So you want to make sure that you have a copy of what you actually put into the portal.
And a pro tip, have someone who has not looked at this at all review it. So
Great.
once you have that budget done and you think everything matches, at that point, I can't look at it again because I'm not going to find something. But I will tell you, as someone who has served on multiple federal grant reviews myself, for various divisions at HRSA and other federal agencies, CFDI and such grants, they will analyze this. Those reviewers will notice if one little thing is off. So again, having a clean set of eyes. My husband, who is a teacher, does not even work in this field, has had to review more grants and more budgets and anything than anyone I know. Have somebody else look at it. That's usually, they're going to see something if it's off.
We're going to now talk about sustainability. It's really, especially recently, it's not uncommon to see an emphasis placed on project sustainability in a NOFO of a project grant. It assures the funder of the probability that this project is going to continue even after the grant is funded. Now, there are seed grants where, they're not talking about sustainability, but if your NOFO is mentioning sustainability, you need to be paying attention to that. If there's an opportunity to bill and collect revenue on a project budget, your budget should reflect this anticipated income as a demonstration of that future sustainability. It puts you in a more competitive position, and it's also going to allow you to build a more robust budget. For example, if there are certain things that aren't allowed in the spending, but you know that this investment would make your project better, you can put that in the non-federal part of it. As a CFO, I will tell you that when you hear the word earned income or project revenue, I frowned because it means more, you have to do more tracking. But do know that adding that earned revenue does typically make a budget more competitive. Any input on that one, Elizabeth?
No, I mean, just always be thinking about how you can make your program sustainable from the beginning. The one thing I hate as a grant writer is we never want to see a program that we start go away, right? So
Right.
always be thinking, even if you're saying, well, I can't do this, it's at the schools. Oh, yes, you can. Let's figure out how to get that in scope and bill for it. Well, I don't know. This is just a service we do because we've done it for 40 years at the jail. Well, just because you haven't been billing it for 40 years at the jail doesn't mean we can't make the jail a site or a rural health clinic or something. I've been working with people, think outside the box. We've added rural health clinics into nursing homes. We've added FQHC sites to do home visits, added those to their scope to make sure that you can capture all of that. And I think we're ready to go on.
All right. So we're almost ready to actually start the budget. But there are 3 filters that you always have to use when creating that budget. Is the cost allowable, which is in your NOFO, allocable, which means it is that you can take that cost and it can reasonably be assigned to a specific project or an award. And is it reasonable? That particular line item, the unit and the item itself makes common sense. For example, we know that marketing giveaways at outreach events are typically not allowed on a federal budget, so it's not allowable. And we also need to use that reasonable common sense approach. So let's say on that same outreach type of a project budget, you're going to do outreach twice a month. But on the budget, you have assigned your community health worker a 1.0 FTE. That's really not reasonable. That they're not going to spend 100% of their time on an event that is going to occur twice a month. So again, common sense. Speaking of common sense, okay, for organizational budgets, okay, there we go. Such as your HRSA SAC or your NCC, your number 1 priority, if not your only ask, should be for funding to support your staffing. We know that personnel and fringe typically for a health center is about 70% of your total expenses. HRSA understands that. It's a very clean way to budget, and there's not going to be a lot of movement in that. Elizabeth alluded to, yes, you'll have some turnovers, but if you put it in staffing, it's a very easily reportable, common sense way to budget. And it's also a way to secure that you've got the resources available to pay your staff. So again, keep it simple. we often are asked about how about the fringe benefits? Do we include fringe benefits? Do we not include fringe benefits? And my recommendation on that is what makes sense for you. If your organization tracks the whole person, including their fringe benefits, that's how you should budget. If your organization, your accounting and your HR systems, it's easier just to track the salary and wages, just do that. But the important thing is to be consistent among all federal grants. If you've decided I'm just going to budget salary and wages, do that on your SAC, do that on your project budgets or your other, just again, consistency. There is no right or wrong. Okay, personnel costs. As I think most of us are aware, there's an executive salary cap that can be charged on federal grants. That does not mean you can't pay an individual higher than that salary cap. In this example, we're showing that Dr. Jones, his base salary is $250,000. That's okay. But on this federal grant or any federal grant, you can only show, it has to be adjusted down to that 225,700. So if you're allocating 100%, you're allocating 100% of his FTE on the grant, that means that would be that 225,700. The balance, that 24,000 balance, 300, it's included in your non-federal side of the grant. A common mistake that we often see is, okay, I'm not allocating 100% of Dr. Jones. I'm only allocating 25%. So that mathematical calculation is 25% of the 225,700, not the full base. That's just a common mistake that you often see. While we're talking about staffing costs, fringe benefits vary widely among organizations. And if you are showing fringe benefits as only one line on your budget, you're showing your total fringe benefits of 500,000. Within the description on your budget, you need to allocate the percentage of how that was calculated. For example, in your description, you're going to put FICA 7.65, health and dental 15%, life and disability 2%, whatever it is. Some organizations choose to show each as a separate line. Others choose to show it as a group. Really doesn't matter as long as you're showing HRSA how the allocation is broken out. Okay. Operational expenses. Again, this is just making it easy on your reviewer and it supporting your budget, all of your narrative. It's a tool where your review team better understands your requests. For example, on the example that we put here, if I were a reviewer and I saw that your rent for the year was only saw for the rent for your year was $540,000, I'd say, wow, that's a lot of rent they're paying. But because we have itemized it and said that we've got 15 sites at an average of $3,000 a month, easily understandable. Again, give them the basics. Another item that we are recommending is we know that HRSA captures and reviews, they pay a lot of attention to what our cost per patients and our cost per visits are. So we're budgeting to our review team. So if we can show on our supplies what our average cost per visit or our pharmaceuticals, our average cost per patient is, that just, it goes into supporting your role as a healthcare organization, and it brings it down to the patient level, easy to understand. All right. We know that most federal budgets, I feel like I'm like flying here through, but we know that most federal budget group expenses into 9 categories. You see them here. Don't need to go into explaining them as you know what they are. But I do want to recommend, go ahead.
I was just going to say, make sure to check your indirect rate if you have actually filed it and if it's actually been approved. We have a lot of people tell us they have an indirect rate and it's not actually been approved. And honestly, as much as you can get by without having indirect costs, I think that looks better on budgets. I understand some of you are at organizations where that's not an option, but just throwing that out.
Absolutely. One other quick, even if you don't have an indirect rate on those budgets, like don't delete those categories. Instead, in your description, show as none with a 0. And that way your reviewer knows that you just didn't, oh, that wasn't oversight. It was a direct, you're not allocating for those expenses. Travel allocations, sorry, Kate. For an annual operating budget, many organizations choose to show this as a stipend. So it would be, the stipend amount times your educational allowance times your number of providers and administrators. It's a very easy way to budget for that that you're covering their CMEs. But for a project budget, they want to see more. So make sure that you're going into the federal GSA per diem rates and using that by city for the, like if the travel is in Washington, D.C., make sure you use your Washington, D.C. Per diem
And
rates.
I know we have a couple state reps on here, people that work at state. If you are writing a state grant, you have to follow the state rules. In Indiana, the state mileage rate is much less, significantly. Right. So this is federal rates. If your state has different rules, or there are certain funders that even have different rules, and they say they'll pay this or they'll pay, so much. So again, pay attention to those rules. And to be honest, this is where I love, if you work with me, I love putting everything in personnel and salaries because it's easier and cleaner. But again, also pay attention. There are some grants, specifically federal grants, and even some foundation grants that require so many people to go to conferences. Right off the bat, rural residency program, teaching health center planning program. They have a lot of meetings that they require. Some of the Office of Rural Health Policy grants they make you come for reverse site visits where you come to DC instead of them coming to you. So again, pay attention to that because that is something that I actually have been a federal reviewer on. Someone misses the fine print, you have to go to a federal meeting. It's not in your budget. They'll throw the entire application out over that.
Yes.
Okay, thank you.
And a best practice on that mileage is just pick one, pick the lowest, and use it for all of your grants so that your reporting is easier. Equipment definition. We need to be aware that the definition for equipment has changed. It's for a single unit acquisition price of greater than $10,000. Used to be 5, so anything under that 10,000 threshold is considered a supply. And this is one of Elizabeth and I's favorite topics on construction and equipment. Elizabeth, you want to expound a little bit on that?
Yeah, I mean, again, as much be ready if you buy a big piece of equipment, and I'm telling you, I've got ultrasound machines and mammo machines. The government may have a stake in that, or your funder may have a stake in that for so many years, up to 5-7 years, where it's not even worth anything at that point. I get that. People tell me this. Please know that if you put federal dollars into a construction project, they may put an NFI, notice of federal interest, on your property. If you got the Bezos money, the Mackenzie Scott Bezos, $5 million to do what you want, awesome, do whatever you want. But if you are using federal, especially federal or state, any kind of government money, typically we always say, be careful, don't spend it on equipment and construction. Spend it on people. You're already tracking that. This is a true story. I literally had to close out a grant for a county health department. And it was located on the Indiana-Ohio state line. We had to track dental equipment all the way to Texas. So you do not want to be on that. Where Kara and I were, if you know Kara, there's lots of stories involved, but we literally were tracking dental equipment and the panographic x-rays all the way to Texas. So again, it's just cleaner if you use it for things you're already tracking. And just know if you own your property or building and you're putting federal dollars, they can put an NFI. The short version of that, you no longer have a clear deed on your property. Most people don't want that. All right, thank you.
We talked about, Elizabeth talked just a little about indirect and de minimis rates. I do want to make a note for that makes sure that when you're looking at your NOFO, there are certain types of grants that do not allow for your full de minimis or your indirect cost rate. So there again, read that NOFO. We found in teaching grants or Ryan White grants that cap usually is around 10%. So you can't use your full rate that you're normally used to. Read the NOFO. Okay, a couple of things on finalizing your budget. HRSA uses a balanced budget methodology. Your revenue and your expenses have to equal 0. If you're working in a loss, you're working in a loss. You add this amount at the top of your budget under revenue as applicant contribution. If you're working with a net profit, show that under expenses as retained earnings to the organization. Historically, for example, when I started as FQHC, people were reluctant to show that reasonable organizational profit. That's not the case anymore because there was an old school of thought that, oh, HRSA's not going to continue to fund me if I'm making money. Well, that mindset's no longer relevant. Instead, the value of having a reasonable earning is actually a positive. With COVID and cash flow disruptions of like cybersecurity kinds of events, the federal government understands the positive benefits of having retained earnings. So don't be afraid to show that reasonable profit. It makes sense. It's a positive thing, not a negative thing. Finally, double check your math in all areas of your budget. Do it in your description, do it in each category. It needs to equal. It needs to equal. This is your best friend, is your old-fashioned calculator, because Excel rounds things. When you upload your budget, you're going to be uploading it into a one-page PDF. And that one-page PDF, if you go through and you add, it may not add correctly because your Excel has rounded. I've had, early in my career, I had a budget returned to me that I had made a rounding error in the personnel justification at the bottom. And it was many times they'll be returned and they'll say, correct the budget. And that's it. So it can take hours to find a small rounding error from your Excel spreadsheet if you don't check that at the beginning. And again, we recommend putting that into a PDF so that you can see it, even if they don't allow a PDF and it's an Excel, put it in one page. Again, keep your thought process focused on the reviewer. How am I making this easier on the reviewer? Okay, the last thing is your budget narrative. Although we're presenting and you present a detailed line item budget, many times the NOFO also wants a budget narrative to be included. And if you've done your job in your budget, this budget narrative is truly a summary, and it's also an opportunity to explain any unusual allocations or trends that that reviewer may not be anticipating. If there's a big variance from last year or there's an unusually large investment in something, this is your opportunity to really explain it. But again, it should be a summary of what they've already seen. No surprises on this narrative. Again, for the reviewers, this is the last thing you're doing. And you take that reviewer's lens and you say, this gives me the idea. Does this give us the budget narrative? Does it give a robust understanding of how the budget supports the grants and the goals of this project? Elizabeth, do you have anything else to add before
I think we're
questions?
good. We will try to stay on here. I know we're at time and we wanted to make the most of every single moment. So if you have questions or thoughts, we can stay on and answer those. Also, you can feel free to email us. We'll put that on the next page here, our email, and we will get back with you. If we don't get back to you within 48 hours, send it to us again because we must have missed it. We always pride ourselves on being very quick in our correspondence. So again, thank you so much for your time. Thank you to Kate for organizing, and we appreciate everyone's time. Susan and I will stay on to answer questions. And Kate, if any of them have came in, we will defer to you.
If anyone is staying on for questions, there were a few great questions that came through on registrations. First thing that we should definitely touch on is that we have several attendees that have joined today that are maybe new to grant writing and budget development. So curious if either of you have perspective on some good resources that maybe somebody could look to learn how to build a budget.
Yeah, I mean, definitely, look at examples. There are successful grants that are online. Look at each agency or each funder, each foundation's online pages. If you have specific questions, reach out to us. We can probably send you an example, a de-identified example if you need anything. And also our YouTube page has some resources about how to get started with grant writing and some budget basics as well. So those would be where I would go to right off the bat. Also, grants.gov has a great YouTube page, as hard as that is to believe, I get it, but they also have a lot of good resources about how to complete their budgets. I send my team to their webpage regularly. So, all right, next question.
Yeah, one question that came through is, should you budget with the assumption of turnover or full staffing?
I always budget with full staffing. Turnover is going to happen. There's some flexibility there, but you do not want to budget for turnover. We always want to anticipate the best. So, and again, funders do understand things change and they're willing to work with you on that.
Awesome. One other big question, and then we can get to any that are in the chat if you all have questions that are still on. What sorts of red flags do you think that federal grant reviewers are most looking for?
Personally, there are two big things that I would think is unallowable expenses. I mean, you just if there is something that's unallowable on any federal grant or this specific grant, they're looking for that. And then the other thing is again that common sense approach. If you look at a budget and let's say that you've got, again, I'm being ridiculous here, but you've only got 100 patients, but your medical supplies are 5 million. That doesn't make sense. So again, you having that second person review that budget, as Elizabeth suggested, will kind of sniff out some of those like, oh, this doesn't make sense.
And the other thing is just something not matching. So if your SF 424 doesn't match your budget narrative, doesn't match your attachment 3, doesn't match your project narrative, when something doesn't match, they will zero in on that.
Well, appreciate you both so much. Thank you for your time. Thank you for hopping on to share all of this. Is there anything else that you wanted to make sure that we covered?
Yes, we'll be sending out the recording. You also can find this on it will be on our YouTube page. I think Callie will have it up. Give us a couple weeks. Sometimes it takes time. And we will send out the link to the YouTube page in the follow-up email for those registrants along with the slides. So we'll make sure you have that. I'm getting individual messages about will the recording be available. So feel free to share that. My kids make fun of me because I have a YouTube page, but we do send that out. And I was at a conference last week. People kept coming up. We go to your YouTube page or we listen to your YouTube page in the car. It made me feel good. They're like, we've learned so much from it. So again, we will be sharing that accordingly. So, all right. Thank you, everybody. Oh, there's our link. Callie put the YouTube link, everybody, and we will also make sure that gets sent in the email so you can click on that and get right to it. So, all right. Thank you all.
Bye-bye.